Care has 25 years of excellence, 36 state-of-art manufacturing facilities. We have 300 plus products in our portfolio and presence in 126 plus countries. Heathrow Healthcare has 21,000 employees globally and is the largest closely held pharmaceutical company in India. Heathrow Healthcare is among the largest manufacturer of ARV, APIs, and FDFs in the world and is Asia's largest manufacturing facility at Visakhapatnam, Andhra Pradesh. Heathrow Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. Today's program, Experience Sharing Program and Managing PPH, we have got Honorable Speaker Dr. Haleh Badar with us. Welcome, Madam. Dr. Haleh Badar is MBBS DGO MD Gold Medalist.
Thank you, sir. Thank you very much.
Patna Medical College Hospital, ex-resident PMCH Patna, Shifa Medical College Hazaribagh, and practicing in Hazaribagh. Madam, welcome. Over to you.
Yes, sir. Good evening, everyone, and welcome to this meeting on Carbetocin. Thank you for joining us today. Now, before going through my experience, I would like to go through some overview regarding Carbetocin. It is considered as a front runner in preventing PPH, particularly in specific scenarios and low resource settings. It has become a promising alternative to oxytocin because of its heat stability. Now, as we know that PPH is a very life-threatening condition, and especially Indian population is facing this condition during and after delivery, and because it is a low resource setting country, so it is a leading cause of maternal mortality in these countries, and primary cause of nearly 1/4 of all maternal death globally. Now, before going through, I would like to introduce some of the uterotonics drugs that are used in PPH. It is widely used oxytocin, syntocinon, which is widely used in cases of PPH in managing it. But apart from that, other uterotonics are also there, like carbetocin, methergine, then misoprostol. But these drugs are also having many disadvantages, side effects, and many contraindications are there. So a new formulation has come, which is a heat stable formulation. Kindly proceed the slide, please. I'm unable to proceed it.
Can you see it, madam?
I want to go further in the slide. Can you please skip the slides?
Tell me.
This is the PPH slides here.
Tell me where, huh? This is okay?
Where Carbetocin slide? Yeah. Stop. You can stop here. Yeah. Now, I would like to go through a few of the characteristics of Carbetocin. It is a long-acting and synthetic analog of natural hormone, that is oxytocin, and it causes uterine contractions. It has increased elimination half-life, and it has got high lipophilicity. I would like to tell that this high lipophilicity characteristic of Carbetocin leads to large volume of distribution of the drug in the body. And this is why there is increased duration of action, that is till 4 to 7 times more than that of oxytocin. So it is primarily used to prevent PPH especially in cases of cesarean deliveries, vaginal deliveries. It is a heat stable compound, so it reduces the need of additional uterotonics during cesarean delivery, and high efficacy leads to reduction in chances of blood transfusion. So before going through its uses, I would like to go through the details of its mechanism of action of Carbetocin. Basically, it binds to receptor, that is oxytocin receptor in uterine smooth muscles, and there is activation of a specific protein, that is GQ protein, after the carbetocin binds to receptor, there is activation of GQ protein, which further leads to increased intracellular calcium ion concentration. And this further leads to increased rhythmic uterine contraction and increase in frequency of existing contraction and enhanced uterine tone. This prevents PPH by preventing uterine atony. And it has got prolonged effect due to its longer elimination half-life, that is 40 minutes elimination half-life is there. So carbetocin is, it can be given, it is usually given in single dose. This is the advantage of it, and it is also called a biased agonist because it works specifically on GQ protein. And here there is the difference with oxytocin. Oxytocin binds to all the G protein subtypes, and so its elimination half-life, its duration of action is less, and so we need to give multiple infusion of oxytocin. Now, there are many indications of carbetocin. One of the most common indication is prevention of PPH. Previous slide, please. Previous slide. Prevention of PPH, and it is also used in during cesarean deliveries, after delivery of the baby, as well as during vaginal delivery. During cesarean deliveries, it is usually administered by IV route because we need immediate action and action to prevent PPH, to avoid bleeding. And during vaginal deliveries, after delivery of baby and placenta, we give IM administration so that we get sustained effect of carbetocin to prevent PPH. Now, route of administration, we can give carbetocin both by IV as well as IM route, but it is given in single dose, that is 100 microgram, and it is usually given in 1 ml solution, and so after that its action starts. Next slide, please. Now, coming to comparison of carbetocin versus oxytocin, as we have specified before, that the mechanism of action, both of them work on same receptors, but carbetocin is more specific to GQ protein, and this is why there is a longer half-life, longer duration of action in cases of carbetocin, and in case of oxytocin there is a shorter duration of action, and so we need to give multiple infusions. Now, oxytocin is given in by IV as well as IM route, and half-life is only 1 to 6 minutes, whereas heat-stable carbetocin, the half-life is 40 minutes, and it is given either by IV route or IM route. When given by IV route, there is sustained uterine contraction within 2 minutes and lasts for about 6 minutes, followed by rhythmic contraction for 60 minutes. And when given by IM route, the sustained uterine contraction lasts for about 11 minutes, and the rhythmic contraction lasts till 120 minutes. So usually after vaginal deliveries, I have also seen many patients of uterine atony, they respond very well after giving IM carbetocin. After delivery, we see that their uterus is contracted till longer duration, and so PPH is prevented. Now, oxytocin is thermosensitive. Oxytocin is thermosensitive. It requires a good cold storage facility, and storage should be between 2 to 8 degree Celsius continuously. And to preserve it, this is the limitation of oxytocin, that where we can't maintain cold chain properly, there are chances that the drug gets deactivated. But in cases of heat stable carbetocin, it can be stored up to 30 degrees C. So no specific condition is required in cold storage condition is required. So in low resource setting condition, they can be easily Now, coming to indications of oxytocin, it can be given for induction of labor or augmentation. It is given for augmentation of labor for prevention as well as treatment of PPH. But heat stable carbetocin is given only for prevention of PPH cases. It may also be given in cases of retained placenta, as I will go through it further in the slide. Please skip the slide. Now, coming to us, there are many clinical studies done for users of carbetocin, and the largest randomized trial was done, that is champion trial. It is a double-blind randomized trial in order to compare the effectiveness and safety of this carbetocin to oxytocin in prevention of PPH after vaginal birth. In these patients, approximately 30,000 women were enrolled across 10 countries, including India. And it was concluded in this trial that carbetocin is comparatively more efficacious than oxytocin, though the results are comparable in oxytocin also. Further, skip the slide, please. Now, this was also the result of this champion trial, where carbetocin was found to be non-inferior to oxytocin for prevention of blood loss of at least 500 ml or use of an additional uterotonic agent. So there was not adverse effect did not differ significantly between the two groups of oxytocin and as well as carbetocin. This was a Cochrane review for preventing PPH. 11 studies were data from 11 studies were taken involving approximately more than 2,600 women, and it was concluded in this review that for women who undergo a cesarean section, carbetocin resulted in a statistically significant reduction in need for therapeutic uterotonics compared to oxytocin, where multiple dosing and continuous infusions may be required in oxytocin cases. And also, carbetocin is associated with less blood loss as compared to this oxytocin in prevention of PPH for women who have vaginal deliveries, and is associated with significantly fewer adverse effects. This is because carbetocin also one mechanism of action I forgot. Carbetocin also causes somewhat thickening of blood. So in through that mechanism also, there is less blood loss in cases of carbetocin. Next slide, please. Now, there are various guidelines recommended, and most important was guideline recommended was from WHO for use of carbetocin. Another guidelines were from Canada, SOGC, then from New Zealand, FIGO guideline, Germany guideline, then FCOG, France guideline, where carbetocin was shown non-inferior to oxytocin for prevention of for PPH prophylaxis. Next slide, please. So, according to my experience, my overall experience with carbetocin till date is highly positive. It is an effective and safe alternative to traditional uterotonics, particularly valued for its long duration of action and reduced need for extra medical intervention during and after childbirth. So this is the case, first case where patient aged 28 years, second gravida, she was para 1. She was admitted at 38 weeks with no significant medical and medical history, but she was a case of previous cesarean section, and she was admitted because she was in labor fetal distress, and so decision was made for emergency cesarean section because of scar tenderness. Intraoperative finding during she gave birth to a live female 3.2 kg baby, and placenta was delivered, but there was significant bleeding. So, first line, I gave her carbetocin 100 microgram IV bolus after placental delivery, and then oxytocin was also added 20 international units, and outcome was that approximately 500 ml of blood loss was there, and uterine there was rugosities in the uterus. Uterus was contracted very well, and no additional uterotonic was given. And post-operatively, hemoglobin was 10.2. Her pre-operative hemoglobin was 11.5. Patient was discharged on post-operative day third, and there was no post-operative events were totally uneventful. There was no complication reported. Then second case was a case of cesarean section, a case of normal delivery. She was primary, and she was admitted at 39 weeks, and there was no medical or surgical history. She was in spontaneous labor, and there was normal fetal monitoring, and she gave birth to a live male child, 3 kg. Placenta was delivered, but there was moderate bleeding after placental delivery. Uterus was slightly flabby. So then and there, 100 microgram IV bolus was given after placental delivery, and then the uterus got contracted very well, and no additional uterotonic agent was given. Post delivery hemoglobin was 11. Pre-delivery hemoglobin was 12. So there was no significant blood loss, and after that, patient was discharged on day 2 without any complications. So this was the second case. In similar way, I have also presently I'm using carbetocin in almost almost all the patient, yeah, especially those with having previous history of big baby or previous history of uterine atony, and I usually administer 100 microgram of carbetocin IV, and then patient gives very good response after administering carbetocin. There is no need to give her even methergin or oxytocin or any other uterotonic agent. And after 5 hours of delivery, also patient is also doing very very well. No extra bleeding is there, and her hemodynamic condition also, her blood pressure, pulse, everything is within normal range. According to me, carbetocin should be considered to be first line agent, because it avoids any additional drug infusion or any kind of bleeding, according to me. But there are many side effects of carbetocin which are mild and transient, like nausea, vomiting. Patient also complains of headache, sometimes flushing, abdominal pain, abdominal hypotension may be there. Sometimes that is also transient. Tremors may be there, shivering may be there. I didn't go through a case having bronchospasm, but there have been cases of rare cases of bronchospasm, especially in cases of asthma. So we should usually take a proper history of the patient, or any history of breathlessness or asthma in past. It should be avoided in such patients. Then
And
there are
since
many
long,
contraindications. Yeah, yeah, Dr. Prashant.
since how long have we been using
I'm
carbetocin?
using, I think I'm using since 1 year I'm using,
1 year.
and the patients are giving a very good response after giving
Correct.
carbetocin.
And you're using IV or IM?
I'm using usually in cases of cesarean section,
Okay.
I'm using IV, and
IV.
in cases of vaginal deliveries, I use
Correct.
IM. Depending upon the condition,
I
upon the clinical
understand. I
condition of the
understand.
patient, upon the
Correct.
situation,
Correct.
I usually, yeah.
Lovely hearing your experience. You have already said this patient profile where doctor can anticipate a PPH. But madam, what is
Yes.
your opinion about anemia causing a PPH in our country?
Anemia, yes,
High
anemia
risk
is a
factor.
very, the most common condition further leading to PPH. So we should always correct her anemia. We should always, before delivery or during ANC, we should always try to correct her anemia. At least it should
Correct.
be 11 gram by giving supplements, or better when she is in her third trimester, or she should be given either injectable iron or blood transfusion, depending upon
Yes.
the grade of anemia she has. So it is
And
very
madam, you feel,
necessary
if
to correct
and madam, you feel
correct
if there is
anemia.
any patient on on aspirin or other blood thinners, would it precipitate
Yes.
a PPH?
Yeah, if aspirin or any blood thinner is stopped at 34 weeks, then it is very
Okay.
good.
Okay.
Yeah, and if it is not stopped, or by accidentally if she is taking that, then we should always give her coagulant of vitamin K and all,
Yeah. Yeah. Yeah.
uh, for controlling
So that could
bleeding,
be very
or
common
we should do
in view of,
PT-INR. We should go
yes.
for PT-INR, APTT and
Correct.
all, so that we can manage the patient accordingly.
Today, many patients are in their early 40s or maybe late 30s, and many of them could be on blood thinners.
Yes, and
So,
sir, one of the advantages of carbetocin is that it thickens the blood.
yeah.
This is by advantage is for the patient if she is on blood thinner of,
Yeah.
or her coagulation profile is
Yeah.
deranged, then this will definitely help her in controlling bleeding. Carbetocin.
Any experience in RH negative mothers, madam?
Sir, carbetocin has nothing to do with the Rh negative mothers. It is completely an immunological condition.
Correct. Correct.
So carbetocin does the same work as it does in other patients,
Correct.
just for controlling PPH.
Correct.
There is
Correct.
no difference
And
in
anyways, we give anti-D.
type. Yeah, yeah, anti-D is that should be advised according to patient's
Correct. Correct.
ICT report and her baby's blood
Correct.
group.
Correct.
It should be given anti-D. But carbetocin has nothing to do
Nothing
with
to do.
Rh negative.
If oxytocin is used for labor induction, we can use carbetocin for prevention of PPH, you know?
We can use carbetocin for prevention of PPH if oxytocin, but carbetocin cannot be given for labor induction or
Yes, yes, yes,
augmentation.
correct. It's only for
Yeah,
prophylaxis,
before
as you rightly
delivery of
said.
the baby,
Yes.
we
That's
cannot
the
give
only approved
carbetocin,
indication.
because carbetocin causes very sustained contraction of uterus, which
Absolutely.
cannot be stopped after withdrawing the drug.
Absolutely.
It cannot be
Absolutely.
stopped immediately. It has long
Absolutely.
action.
So it's
So
always
it
after
is
the
harmful
delivery.
for the
Yes.
baby.
Yes.
Yes, sir.
I mean, you already said that in cesarean sections you prefer a IV route, but otherwise
Yes, sir.
in other normal deliveries, IM route should be sufficient.
Yes, yes.
How you are coming about this toleration? You said that many patients not tolerated. Well, some contraindications you are referring to.
Yeah. Contraindications are that it shouldn't be given during labor or during
Labels. Yes.
pregnancy. It
Yes.
shouldn't be given before the delivery of baby. It
Correct.
shouldn't be given in severe cardiovascular conditions, because
Correct.
it may cause derangement of hemodynamic profile of the patient. And it shouldn't be given in cases of liver or kidney diseases, if patient is having liver or kidney diseases, or in cases of any kind of hypersensitivity to carbetocin or
Correct.
oxytocin in the past, then it should be avoided in
You are
such
referring
cases.
to spasms, respiratory spasms. People might get after
Yes,
the
sir. It should
carbetocin.
also not be given to asthmatic patients. Yes. If she is having any kind of
Spasms.
bronchospasm or any kind of asthma
Yes.
episodes
Correct.
in the past, then it should not be given. Though rare cases are of bronchospasm has been reported, but it should be avoided in such cases. Care should be taken. So it is well tolerated, generally well tolerated, and lower incidence of side effects are there, which are
Yes.
mild and transient, and there is favorable balance and efficacy of the side effects in this carbetocin cases.
Suppose if the patient doesn't respond to carbetocin, what other
Yes,
additional
sir.
tonics you would use in your order of preference?
Yes, sir. If she don't respond to carbetocin, then there is no use of repeating the same. We can give her
Yeah,
oxytocin, or we can give her methargine if she is not anemic. We can give her carbetocin if she is not asthmatic, and then we can opt for misoprostol tablet.
correct,
Maximum we
correct,
can give 1000 microgram of misoprostol. Other options are also there.
correct.
Other surgical options are also there if medical option
Yes,
fails
of
then.
course. Tamponade and finally the hysterectomy.
Yeah. B-lane sutures,
I suppose
tamponade and all we cannot.
I suppose the major advantage of carbetocin is a single use and you don't require storage conditions. I mean, all others are
Yeah.
uh, looking at our country and looking at the
Yeah,
power
storage
outages that we
conditions
have.
also we don't, because I have seen in medical colleges also or any
Yes,
public health setting, we have seen sisters taking oxytocin in their
I
pocket and
know, I
going here
know, I
and
know.
there. So proper temperature is not maintained.
Correct,
We used to go and
correct,
tell
correct.
sisters and healthcare providers to please
Absolute,
go and
absolutely.
store it at the proper temperature, but they didn't used to listen. And now this carbetocin is
That's
this
a
is easy.
major advantage.
It does
Yes,
not require any cold storage.
correct,
So
correct, correct,
it can be used in low resource, or it can be used even in periphery properly. It can be
correct.
under proper condition, because no proper storage, it can sustain up to more than up to 30 degree C room
Yeah,
temperature.
yeah, that's a major advantage in our country. And even in Mumbai, places like Mumbai, there is
Yeah.
typical power outage very frequently. Do you think it should be kept as a reserve drug or should be used as first line? Hello?
Just the hetero healthcare people to please reduce the cost, because it is a very good drug, and it is a very good drug, and it without not
I
requiring any
understand.
kind of proper cold chain system,
Ah,
and its effect is also very long lasting.
yes,
Its
yes.
effect is also very good, even more than oxytocin. So I would like to prefer it in first line if
I
cost
know.
is not the
Cost is
issue.
the constraint. Yeah, yeah.
Yeah.
And finally, your take-home message for the audience.
Yes, at last, I would like to say that oxytocin is a very valuable way. Carbetocin is a very valuable tool for PPH prevention. It offers better outcome than oxytocin, and it is more convenient than oxytocin infusion. So, in a sense, carbetocin is a more robust, long-lasting
Mm.
version of oxytocin, improving on its shortcomings. So, I would like to convey my message and my request to the company people to please cut down the cost of it, and I would like to also give the message it's better than oxygen. So, it should be used as first line uterine agent in public setting, also in private setting also, so
Thank you,
that
man.
bleeding should be avoided before
Yeah.
only. एक बार bleeding हो गया उसके बाद उसको
Yeah, yeah, yeah. Anyway, madam, thank you so much for
it's
your
better to control beforehand.
yeah. Thank you so much for your insights,
Yes,
your
sir.
practical insights. I'm
Yes,
sure
sir.
they're
Thank you
wonderful
for
practical
patient
insights you have
listening.
given. Yes,
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 sir.
of course.
Thank you.
They're very
Thank you so
interesting.
much for
That's
patient
exactly what our doctors want,
listening.
That's exactly what our
And
doctors
thank you
want.
all the
Yes, yes,
listeners.
yes. Our doctors.
Yes.
Our doctors want, the practical inputs from the practicing doctors, not the theoretical references. Thank you so much. And thanks all
Thank you, sir.
the
And
doctors who took time.
thank you, sir. And thank you, hetero health care people,
Yes, madam.
please, for introducing this drug in their bucket, in their basket,
Yes,
which is helping us to tackle with the very life-threatening condition PPH, which is a great burden for Indian scenario.
yes.
Thank you,
And
sir.
yeah, thanks, madam, and thanks all the doctors who took time and attended this webinar. Thanks, Heat Marketing
Okay.
and Sales Team of Hitro for coordinating. Madam, you can sign off,
Thank
madam.
you.
We wish you a very happy new year, madam. Thank you so much.
Thank you. Same to you, sir.
Thank you. Thanks, Bhuvan. Thanks, Bivas. Thanks, Tanvi.